strong and persistent worry about a psychology course assignment, even when you have a lot of time to complete. This is an example of a person who may have generalized anxiety disorder, also known as GAD. You're probably now thinking that this could be you because you may have experienced this before. However, you may want to think again. It is very common for normal people to experience normal and controllable worry or anxiety. However, for a person with GAD, the anxiety is extreme, persistent, and uncontrollable. It can be so extreme that it may cause the person to have symptoms like constant muscle tension, feelings of relentlessness, irritability, fatigue, have problems sleeping and concentrating. 3 of these symptoms is required for an adult to be diagnosed with GAD and 1 for children. Some more difference about normal anxiety and GAD is that normal anxiety keeps you alert in a healthy way. On the other hand, the anxiety that a person with GAD experiences is so intense that it interferes with daily activities like going to work or going to school. A person with normal anxiety can be easily relaxed with some relaxation techniques like taking slow and deep breaths. However, someone with GAD may have difficulties calming down and relaxing, even when this person knows that the source of anxiety is unreasonable. GAD is usually assessed with a questionnaire called GAD-7, along with some follow-up interview questions. GAD-7 is a questionnaire that asks the client to rate the frequency of the symptoms often found in people with GAD. This is an illustration of how a GAD-7 assessment looks like. Each frequency level has an assigned score of 0, 1, 2, or 3. The final score will be the addition of the score for each of the category. The cutoff score for mild, moderate, and severe anxiety are 5, 10, and 15. After finishing the questionnaire, the mental health professional will proceed to ask questions such as, when did you first notice that your feelings of worry were more intense than usual? And can you recall any particular event or traumatic experience that could have triggered this? Asking this time or specific questions can help the clinician better assess what may have triggered the patient's anxiety and the source of his or her anxiety. Here we introduce 2 main types of risk factors, biological and psychological. For biological factors, researchers indicate that if someone has first-degree relatives with GAD, like parents, siblings, or children that are suffering from it, he or she has a higher possibility of developing GAD. The heritability is around 0.3 to 0.5. As for brain structures, the amygdala is part of our brain that controls our fear responses. People with GAD always show hyperactive amygdala during the processing of negative emotions, which might affect the understanding of social behaviors, which result in perceiving a social cue as dangerous when it is not actually dangerous. Serotonin is the most important neurotransmitter in our brain, closely related to mood and motor behaviors. Its receptors are highly sensitive in people with GAD, creating hyperactivity in different parts of the brain. For psychological factors, people with GAD have difficulty interpreting threats. Even harmless experiences could feel anxiety-producing for people with GAD. Researchers have also found that trauma in childhood can increase the risk of developing GAD. Besides, difficult life experiences can all be contributing factors. So it is important for the therapy to gather family and social history for diagnosis. Using addictive substances like caffeine, alcohol can heighten feelings of worry and nervousness. Relationships can also be a significant source of anxiety, especially in women. Job stress might trigger the development of anxiety, especially great changes like loss of a job. These psychological factors might contribute to the GAD. Some tips about prevention of GAD is to deal with daily stress properly and seek for help before it's too late. Treating GAD requires medication or psychotherapy, sometimes even both. Several medicines have been proven effective for less severe symptoms. Benzodiazepine is a drug that has sedating and calming effect. Antidepressant is also another drug that helps moderate serotonin levels in the brain, thus help elevate the mood. But to mitigate the symptoms in the long term and to deal with the comorbid anxieties, psychotherapy might be a better choice. First, the therapist may adopt a psychoeducation to inform the patients about the causes and symptoms of GAD and convey the idea that it can be treated. Patients may also practice somatic training by themselves through relaxation training, which is to tense and relax their muscles several times, or also breath training, which is taking long and deep breaths according to instructions to suppress the anxiety. Another form of therapy is cognitive therapy, which has been proven effective since it teaches the patient to examine their negative thoughts and challenge it. By realizing that the worst has a minimal chance of happening and that even if it does, the consequences are acceptable, clients change their way of reasoning and behaving towards anxious situations. Although treatment for GAD is available, only 1 out of every 10 people with GAD get adequate treatment. Why? Well, stigmatization stops them from seeking for help. People with GAD are often judged by others. Some common comments they may receive are, "We all have difficulties. He's just too weak. She's too sensitive. They're just lazy. Do not play with him. He's too unstable and dangerous. Not suitable for work. Self-centered." All these negative comments lead to misunderstanding and rejection, which makes GAD people more isolated and self-blame. As a result, their anxiety just becomes worse. But what can we do to remove this stigmatization? Well, there's 3 steps that you can take. First, talk about GAD openly. This will help raise awareness about the negative stereotypes. Second, remember that they are not defined by their anxiety. It is just one small aspect of them, and we all have many different aspects. Lastly, remember, when they share their anxiety, listen without judgment. The problem may sound very minor to you, but the experience can be very painful for them. If you think you have GAD, please contact a mental health professional. Find help. Talk to someone. You don't have to go through this alone. Thanks for listening.